I would like to welcome you to our webinar series on mental health and substance use coercion in domestic violence services. Today's session is titled Building Bridges, Expanding Access to Mental Health and Substance Use Support. My name is Amanda Lyon, and I am the Training and Technical Assistance Manager for our center. Our center is headquartered in Chicago, the unceded homelands of the Council of the Three Fires, the Odawa, Ojibwe, and Potawatomi nations. We invite each person to learn about the land you're connected to. One resource to get started is the website native-land.ca. A little bit about our center. You see the graphic on the right includes the concepts that we integrate into our work and frameworks that we share. We provide training and technical assistance, research and evaluation, policy development and analysis, and public awareness. During our session today, I invite you to take care of yourself as needed. I know we have some difficult topics to bring up, and please remember to take a break as needed. I am here trusting that you are doing what you need to care for yourself. And so please just create that space for yourself and for anyone else you're viewing this webinar with. Today, I'm sharing a simple framework that supports access to mental health and substance use services while centering safety, choice, and empowerment. There are 3 steps. The first is preparation, where we build our readiness, understand barriers survivors face, like stigma, cost, safety concerns, and past harm. Second is planning, supporting safe, informed choices by exploring options together and centering what feels most supportive to them. Third is staying connected, continuing support after we make referrals through validation, connection, and safety planning. Together, these steps can help us to ensure access is trauma-informed and survivor-centered. Again, step 1 is preparation. Each one of these steps has a corresponding tip sheet that you can access on our website and download at any time. Preparation is building our readiness as advocates to offer support around mental health and substance use in ways that are safe, collaborative, and grounded in survivor choice. We prepare before any referral or request for referral is made to create the conditions for access. When we invest in preparation, we build a foundation for support that is trauma-informed, survivor-centered, and responsive to the real-world complexity survivors are encountering. So when somebody is ready to explore options, we are ready to walk alongside them. A person's experience of stigma and coercion, as well as their cultural perspectives, all influence their viewpoints on mental health, substance use, and what might help. In addition to the barriers that many people already face, like cost, cultural responsiveness, and availability of services, survivors of domestic violence may also face barriers such as mental health or substance use coercion, where an unsafe partner has used stigma to undermine and control them. We really must remember that behavioral health resources are not always safe or helpful for everyone, and we need to trust people to know what is safest for themselves. While we can offer information about mental health or substance use supports, accessing those services must always remain a choice. Survivors do not have to engage in behavioral health services in order to access domestic violence or shelter services. According to the Voluntary Services Act, no conditions can be placed on receiving emergency shelter. There are many reasons to believe that people may hesitate or choose not to access behavioral health services. Some people may have had past experiences of being blamed, misunderstood, or not believed. Others worry about confidentiality, documentation, or how information might be shared with courts, child welfare, immigration systems, or abusive partners. Some people have encountered stigma, cultural mismatch, or providers who do not understand domestic violence or coercive control. For someone trying to access services while leaving an unsafe relationship, this might also feel overwhelming or destabilizing. Remember that survivors are the experts in their own lives, and our role is to center their self-defined goals, safety, self-determination, and collaboration. Our support is most effective when it aligns with what survivors say they need, and when we respect both their interest in services and their decision not to engage in services. So first, locate mental health and substance use resources that are in your area. If you're not sure what's available, then use a directory to search. Some examples are findsupport.gov and findahealthcenter.hrsa.gov, which can help you find the closest community health center. Community health centers offer behavioral health services, which are available to anyone regardless of their insurance or ability to pay. We have also published 2 tip sheets on locating resources, which are also linked at the end of this presentation. After you locate resources, reach out to these organizations or providers to gather information and assess if they might be a good fit for survivors. This slide has some questions you might consider asking at a service. This information will also help later as you discuss options or are safety planning with someone. Also, offer community education to any local resources that aren't domestic violence aware or informed, so that they can provide safe and effective resources for survivors. Partnerships with local health, mental health, and substance use support organizations increases survivor access to services, improve responses that support wellness, and use trauma-informed best practices across services. Some ways that you might engage community partners include being informed programs that are aware of the intersections of domestic violence, health, mental health, and substance use. They have routine cross-training, established referral processes, and they may have interdisciplinary teams that include advocates, mental health and substance use specialists, peer support, and others. Collaborative programs share or trade services like co-facilitated groups, where staff from one organization could be on site at the other organization part-time, or you might even have co-located services. Integrated programs have a no wrong door approach, where many services are offered within a program and provided based on someone's self-defined needs by an interdisciplinary team. When behavioral health services are not safe or helpful for someone, we also remember that our traditions, relationships, belief, and culture can all be sources of support and healing. Consider sharing mind, body, spirit practices like the ones offered in our Wildflower Path Toolkit. These connections and resources can also be helpful when someone is interested in other support, but there may be wait times for appointments, or they might be trying out different options. You can also explore other types of support in your community, such as connections to spirituality, culture, nature, creativity, or other supports. We want to have conversations about mental health and substance use as part of routine advocacy. You always want to talk privately about sensitive topics, and these conversations should take place after initial intake or screening, not during. You can show the person where you keep information about mental health and substance use resources that they can access privately if they choose to do so. Focus on building positive, safe, and trusting relationships, and allow the process to take as much time as needed. Sometimes people need to know that we are safe people before they're going to open up and share more about what's going on with them. When talking about sensitive topics, continuously check in for consent to proceed. If a person says no, we want to respect their decision. Remember how many survivors have experienced their choices being controlled, ignored, or taken away by an abusive partner. When we pause, check in, and truly honor someone's no, we are actively supporting their empowerment. We are reinforcing that their voice matters, their boundaries matters, and they get to make choices about their own lives. I'd like to take a few minutes and hear from you. If you could tell me what anything that you or your organization are doing well in any of these areas that we've just discussed. So that includes developing partnerships, referrals, contacts, or cross-training with mental health or substance use resources. How do you integrate safe conversations into your practice? And or are you providing information about resources in your community? So I invite you to use the chat and share a little bit about what's going well. What are you already doing? How are you already connecting people to resources? And one comment says doing warm handoffs. Yeah, that could be a good, having warm handoffs as a standard practice. Doing needs assessments, warm referrals with connections to community resources. Yeah. Building rapport with other organizations. Someone also says warm referrals. See, our women's outreach program connects with health authorities' harm reduction team to reach women who may not be able to come in for services. It's a wonderful connection. See, we have a database / toolkit with resources for member programs. Yeah, it's great if your coalition is supporting this work statewide. Somebody says they're doing well with their partnerships with mental health and substance use providers. Offering conference calls, so no telephone games. Absolutely, that's really big whenever possible to call together if you can. If somebody wants, really wants that connection, being ready to feel like we can make a call. And again, having, talking about in your teams, what are our standard practices for making these connections? Are we really ready to make these connections? We know that different people can have different experiences with the same resource, and we can't predict if a resource will be a good fit. But when we do this work and we build relationships, we can increase the likelihood that we are making connections that are domestic violence informed and trauma informed. We also have in the chat to understand the residents' needs in order to provide referrals, and so they may begin to gain confidence in themselves. Yeah. Taking that time. See, someone else says, we are part of a mental health and substance use agency, so we are able to do internal referrals. We also have a trainee program for ASWs, AMFTs, and psychology students who provide training to advocates on CBT skills and motivational interviewing. That's fantastic. So yeah, really having that is an example of more of an integrated program and integrated services. And it can be so helpful to work at least in that direction, where someone can come in and have access to all the support internally and have who each practitioner or provider is and what approach they're taking. So I'm very happy to hear there are some positive things already happening. And with the information that I'm sharing today, my hope is that this is not all new information. Instead, the idea is to, again, share it as a framework so you can look for, what are we already doing well? Do we have any gaps? And are there places where maybe we could improve our practices? But I know all of you listening today have so much expertise in the work you are doing. And I would expect that a lot of this is familiar, and you're hopefully saying, yeah, we already do that. We're doing that well. That's what we want. So our next step 2 is planning. And this begins when a survivor chooses to seek support. The role of the advocate is to explore options, share resources, and stay grounded in what the survivor is seeking. We have collaborative and transparent processes. And rather than just giving a referral, we want to support informed decisions and create pathways to care that really fits their life, their safety, and their choices. So when someone says they are interested or they're considering seeking support, you can offer to share tools that might help them to think through their options. You can review these tools with them, or they can do it on their own. So for example, the Do I Want to See a Therapist guide can help someone to clarify goals and questions around therapy and feel more prepared to actually start working with a therapist. Other tools include the Guide for Emotional Support and Self-Directed Emotional Support Plan, which Kathy shared about in our last session, plus a new tool that we are working on called Getting Ready to Change My Substance Use, which again can help someone to think through different options about making a change. Active listening and affirmation are so important. We want to take time to learn more about someone's unique needs and experiences without immediately trying to solve problems for them. As you learn more, you can continue to use open-ended questions to explore their experiences. Allow this process to take time. Listen, reflect with them, and stay curious. Validate their experiences and allow space for them to explore their own ideas and solutions. Affirm their strengths and document their self-defined needs, preferences, and goals. You can start by asking if they want to discuss any safety concerns. If they do, collaborate on a plan that reflects their needs, even if you don't have responses or answers or solutions to everything, you can still talk things through. You might want to consider very practical supports like transportation, childcare, avoiding unsafe people, how you are helping to protect their information, understanding confidentiality of other services, and strategies for their own self-advocacy. So focusing on empowerment and self-advocacy includes offering support and information to help them feel prepared without taking over their choices. I know it can feel sometimes when a person shares what's going on, we can have an urge to say, okay, so let's do this, rather than stepping back and really exploring time to ask them, what is really going on? What's really happening with you? How are you feeling? Do you have any ideas for what would make this feel safe? So you can explore a little bit around, what's happening? If we've got something set up, how do you feel about that? How could I be more supportive? You can offer to call together. You can offer to accompany them. You can also explore what kind of support would be helpful after their appointment and how you might be able to support their safety and comfort afterwards. Because working with a mental health or substance use provider can sometimes be upsetting or bring up negative emotions, memories, and they might need some support afterwards. I have a scenario for us to think about. And again, I encourage you to share your responses in the chat. So this is Casey. Casey recently left an abusive relationship. They tell you they feel anxious and are having a hard time sleeping. Their ex-partner previously used mental health stigma, saying that Casey was unstable and threaten to call CPS and get full custody of their child. When offered therapy, Casey says, "No way, my ex will just use it against me with CPS." So in terms of our responses, if we start by validating, what would you say to validate what Casey is sharing? I know advocates are so good at offering validation. So how would you start? We've got, I can understand why you feel that way. Yeah. Active listening skills, validate fears, and case plan for safety and emotional needs. You know your ex better than anyone, so I hear your concerns loud and clear. I would recognize her emotions, including fear. Let them know that therapy is private and confidential. You might say, I get that. That's a real threat to something so close to your heart. You have survived so much already. How have you stayed safe so far? Your feelings are valid. Yeah. Safety plan. Yeah, so I think these are some great responses. Thank you. So that's kind of our first step, is just acknowledging that, yeah, it makes sense that you're feeling this way after what you've been through. It makes sense that you're feeling cautious. And I would say our next step is then, finding that balance of how we trust survivors to know what's safest for them, but also continue talking through. So for example, the next thing you might go into is, so if CPS wasn't a concern, would you be interested in therapy? So you might want to explore a little bit more. So again, rather than just saying, okay, let's look at other options, it's like, let's continue talking through. We've also got in the chat, I am so sorry for what you're going through. I can't even imagine how scared you must be. Whatever you decide to do is perfectly fine. I'm here to support you, and whenever you feel ready, we can take action. Yeah, so this is a good opportunity to, again, focus on validating and then exploring. So wonderful validating. And I know someone said that, letting them know what you know about confidentiality. You might want to explore a little bit more about, what worries you about therapy, or like what feels important for protecting yourself and your child, And I know that we've got that, how have you stayed safe so far? That's a great response. Looking at, what are we already doing for strengths? And also keep in mind, so this might be an opportunity here to offer reflection tools if, Casey is interested but not sure. Does anybody have any other thoughts about what you might initially do with Casey in terms of what you might ask, what you might want to know more about, or how you might offer support without getting into solutions? I know somebody has said safety plan, so yeah, would you be interested in talking about safety planning? Yeah, in the chat, has this happened before in the past? yeah, maybe Casey's had a negative experience that we don't know about. That would be really good to know. If we're not sure, sometimes even, could you tell me more about what's going on? Could be very open-ended, might prompt Casey to tell us some more. When your partner uses your mental health against you, how have you coped? Yeah. Continue looking for what are those strengths? What can we build upon? So again, there's no necessarily right or wrong answers here. I think you all shared some fantastic ways to connect with Casey. And it's mainly just, validating and exploring. Do you have specific questions we can go through? Yeah, you could ask if Casey has questions about therapy. Do you know what they're looking for? Absolutely. Now, our third step, staying connected. This begins after someone engages with resources. So after someone has been like, yes, I want to see a therapist, I want to go to a support group, and they've had that first step. So as advocates, support continues because those barriers and challenges will keep coming up. So you might be checking in, listening, problem solving, and revisiting safety planning. We affirm their choices and strengths, reinforce trust, confidence, and empowerment throughout this journey. And I like, again, the last comment shared in the chat. Would you be willing to talk a little more about your relationship so we can figure out where to start, specifically by focusing on your mental well-being first? Yeah. And I will share these, the tip sheets also have these conversation prompts, several ideas for how you might ask a question included throughout. So the first part of staying connected is exploring how it's going. So if someone's trying out a new resource, it can be really helpful to talk about that experience with a trusted person, which could be an advocate. Advocates can explore whether this is a good fit, validate experiences, and work on collaborative safety plans so they can stay connected. And we can also let people know if they have a bad experience, they can always try something else, and really validating that that is okay. Because again, we want to support their choice and empowerment. Safety planning is an ongoing process. Accessing services can be complicated if a current or former partner tries to interfere. Again, we always start our conversations with consent. And your safety planning can include reviewing and updating existing safety plans to just incorporate anything new that comes up. So continue to address safety planning and troubleshooting barriers on an ongoing basis. Again, we want to revisit safety regularly, check in about new concerns, and collaboratively identify strategies that support their ongoing access to services. Again, this is really focusing on safety and empowerment. Attending a session or a group can bring up challenging feelings or cravings. Again, this is really normal, especially early on. You can validate their experience, remind them they don't have to continue with something that doesn't feel right. You encourage them to share any challenges and ideas for next steps using their existing strengths and coping. We want to remember that progress will take time, and that healing is not a linear process. And that's okay. So it's okay if someone isn't feeling a huge change right away. Sometimes healing includes feeling worse at times. However, being a support that someone can talk through what's going on with can really help someone to, again, stay connected to those resources, to feel supported overall, and to build their empowerment. So now we have Casey part 2. So this is a little later on. Casey goes to their first therapy appointment. When they come back, they seem upset. Casey tells you that they saw their ex-partner's car at the health center. They also say they're unsure about going back and said they didn't think they thought their therapist didn't know much about domestic violence. Sorry for the typo. They felt uncomfortable answering so many questions and aren't sure the appointment was helpful. And again, sharing in the chat, how might you respond in this situation? And while you're thinking about that and sharing, I want to bring up one piece of the scenario is it can help in some therapeutic situations and behavioral health. Someone might go to their first appointment, and their first appointment might not be with their therapist. It might be with someone else. The first appointment might be someone doing more of a health history and intake that can feel overwhelming. It can actually feel upsetting sometimes because it might feel like you're just going through all of my problems in my life and I'm not getting any help. So if we know that is going to be the case, we can also help to prepare someone before they go. Or in situations like this, we can also talk about that dynamic that, let's make sure this might not have even been your therapist. This might have just been the intake. So would you be willing to try another visit or two with your actual therapist and see what happens from there? So again, knowing a little bit more about the surface can be helpful. But I would love to hear, with Casey in this situation, expressing some concerns. What else might you say, or how else might you respond? What would come up? And again, if you wouldn't want to start with validation, what might you say to validate Casey's experience? Got in the chat. That's all right. I'm glad you told me about these issues. We can try and find another therapist that is experienced with domestic violence counseling and can do telehealth appointments so you don't have to worry about running into your ex. Yeah, offering other options. Telehealth can be really helpful for people who are concerned about this or people in rural communities. Tell them they were very brave for taking this chance and be realistic that it might take time to find the right therapist. And then someone says, why not prepare them ahead of time so the experience isn't so traumatizing? Yes. And that's a great comment, because the more we know about a service, the more we can prepare them ahead of time. So it's one of those cases where if we knew that they were going to have a separate intake with a separate person who wasn't their therapist, we knew that was how that organization operates, we could prepare them. And hopefully we have done some safety planning ahead of time too. Great comment. So thank you for sharing these concerns and feelings with me. We have options to explore, so let's chat about those. Yeah. Thank you for discussing your concerns with me. Before you saw your partner, was there anything about the visit you felt was beneficial? Having a second visit might give you the opportunity to evaluate things you like or dislike, so we can discuss them with this provider or another one. Yeah. It sounds like the first appointment had some concerns for you. Thank you for telling me about what you experienced so that we can think through what you might want to do next together. And then, oh no, what a coincidence. I imagine that must have caused you some anxiety and frustration. If you don't feel comfortable being in the same building, knowing that he might be there, we could look into finding a different therapist, or alternatively, we could coordinate with your current therapist to ensure your appointments are scheduled for different days and times. That is, if you would like to continue seeing this therapist. Yeah, so there's a lot of people offering some different options that might help Casey to feel more safe and comfortable, or at least opening the door to explore with Casey, which again, rather than be like, oh, we're just going to stop therapy, we're just going to not go back or do anything. We want to hold space, be like, well, let's explore, because you are a strong person and you have a lot of things that you are already doing to take care of yourself. And let's see if we can figure some things out together. So I think you've got some great ideas. You know, if you find a resource truly doesn't have that domestic violence informed care, that's also an opportunity that maybe your organization could work on some cross training. Maybe you could help them to be a better resource too. So this is great. Thank you all. So remembering these stages, the preparation, planning, and staying connected are not a linear process. They're really ongoing. Trusting people as the experts on their own lives, knowing that needs and goals may change over time. Our support can remain consistent even if their choices shift. We can stay flexible and responsive. We want to remember that conversations take place and we provide information with consent, allowing their no to be that valid and respected choice. Remembering that behavioral health resources are not just one size fits all, and that it's normal to have mixed experiences. We want to name and plan for safety. We want to validate their experience and emotions ongoing. And of course, remembering that service access is voluntary and offered without judgment or pressure. And as advocates, you are helping to really build that access, excuse me, build access and support their autonomy. And I'd like to take a couple of minutes just to think about this. With what we've been talking about today, do you have any ideas for how you could strengthen any of the things we've been talking about in your own work? What is like one small actionable step that you could take? More resources? Yeah. I know there are many people who are oftentimes rural and rural communities, and to remember, if you are in a rural community, there are so many online support groups for mental health and substance use that are free that can be accessed by anyone. Researching referrals before offering them as a resource. Yes, I know that can be hard, but whenever we can, to try to make space for that, and especially if you can be supported by your team or your coalition in researching and understanding these referrals before we actually make them. Preparing people with what to expect can be so helpful. And, again, that can help somebody to walk in and be like, even understanding like, okay, this might not be the most fun appointment for me today, but this is what we're going to do. Okay, that can really help. Knowing the resources in your community. Yeah. And, being creative too, looking beyond what is available just with mental health and substance use, but what kind of programs does your local library have? What are the cultural organizations? What are the dance classes? I used to live in a small community and there were still several things in the community for people. Maybe a community garden is available for people. There might be other community resources who would be willing to partner and potentially offer access to what they're offering to the community for free or very low cost. Strengthening partnerships, making sure we have solid resources for survivor needs, and we're offering those partners support in working with survivors. Yeah, these webinars. Communicate with peers and colleagues and maintain a survivor-centered approach. Yeah, absolutely. You need support. You can't do this alone. You want to use your teams to do this work together. Take time to learn what's locally available for mental health and substance use. Plan time to vet those resources so you can provide the best information possible. Yeah, it's like, think of that first phase, the preparation and building readiness, building capacity is truly your foundation, because we have to know about these resources before we can effectively share about those resources, so that somebody can actually, we can increase their likelihood of staying connected and having a better experience. Thank you all so much for sharing. I really appreciate you being with us today. And I want to open it up to see if we have any questions. Again, you're welcome to put your questions in the chat. If you want your question to remain anonymous, you can send it to just the hosts and panelists, and I will see it. And while you're thinking of any questions, I had mentioned our Wildflower Path Toolkit. It's linked in the slides. We also have our Survivor Help Connections resource page that has these tip sheets and several other resources for helping to increase that access and build collaborative relationships. This is the link to the tip sheet series. There are 3 tip sheets. Here's the links to locating different types of resources. Here are tip sheets for building collaborative relationships with different resources. A link to the guide for emotional support. The Do I Want to See a Therapist guide. We also have information about supporting survivors who are using substances, because I know that can be a big topic in many programs. I appreciate all of the gratitude so far. Thank you. And yes, you will get a follow-up email with a copy of the slides as well as our evaluation. We also have some information about confidentiality, looking at across different types of services, and we have conversation guides for how you can get to know more about the confidentiality practices of different resources. We also have other trainings available on the learning community. If you want to learn more about mental health and substance use coercion, we have our toolkit. And for anybody in program leadership, We have these tools about making sure we are offering accessible and voluntary services. And then we also have toolkits and guides for supporting families. I invite you to sign up for our newsletter. We typically send out one email per month with any webinars or new information we are offering. And yes, our website has all of this information. All of our resources are available on our website for free for anybody to access and download at any time. And this is me. If you have anything that comes up afterwards and do want to reach out, you're really welcome to reach out, send me an email. Let's see. And Kathy was unable to join us today, but originally she was going to be here as well. And I'll stop sharing the slides and take a moment to see if there any other questions have come up in the chat. So far, not seeing anything. But feel free to enter some in. We still have a couple minutes, but I want to really thank everyone so much who attended our webinar today. I really enjoyed our session. We want to thank our interpreters and our team who supported this. Christine has provided our survey link in the chat a couple of times. So if you could please fill out our survey and let us know how we did today. Within the next week or so, you will all get a follow-up email and a link to the recording of today's webinar. You will also receive a certificate of attendance for your time today and a link to the evaluation again. So thank you again, and I hope you all have a wonderful afternoon. I will stay on for another minute in case anybody has any final thoughts or questions, but I believe we can stop the recording and the live stream. Thank you so much, everybody. I really appreciate your gratitude. All right, looks like no more questions. Thank you, everybody. Have a wonderful rest of your day, and hopefully we'll see you again soon.